My name is Lesley McAra. I'm Professor of Penology in the School of Law at the University of Edinburgh. For the past 27 years, I've been co-director with my good friend and colleague Susan McVie of the Edinburgh Study of Youth Transitions and Crime. This is a longitudinal study of pathways into and out of offending for a cohort of around 4,300 young people who started secondary education in 1998. And the cohort is roughly 40 years old just now, so this has been a long time doing this study. The study itself has had major policy impact, both in Scotland. It's also been used in campaigns for penal reform in Sweden and parts of Australia and South America even too. And Susan and I are really delighted about that. But within Scotland, its major policy impact has been on what's called the whole system approach in youth justice. And this is based on diversion from formal measures wherever possible, and diversion to well-invested, early and effective modes of intervention. So it's diversion to something positive. Drawing on the findings from the Edinburgh study, as well as a slightly smaller scale study, which I was involved in on adolescent mental health during the COVID lockdowns. And here we surveyed around 900 Scottish school pupils. So I'm going to draw on those two pieces of research to talk about the three lessons that I want to share with you today. The first lesson is the need to pay attention to key transitional moments. Now, the Edinburgh study has highlighted a number of critical junctures in the lives of young people, which are associated with increased risks of offending, as well as increased risks of victimisation. And there is a very strong nexus within our data between victimisation and offending. Now, these transitional moments include, critically, the transition from primary into secondary education. Now, this is a really difficult time for young people anyway. It's particularly difficult for young people who have additional and often undiagnosed learning needs. In our cohort, there were many of them who were involved in serious offending who had undiagnosed learning needs. And also for those who are already disconnected to education through truancy or exclusion. And it's often in this timescale in our study that we saw transition within the way in which children were written about in children's hearings records. There was a transition from being written about as being somebody who was a victim of neglect or abuse to being written about as somebody who was an offender or troublemaker. Their behaviour then became the core concern. And school exclusion in the early secondary education is one of the strongest predictors in our study of criminal conviction in the teenage years, and actually having a chronic conviction pathway into adulthood. And it also is a strong predictor of later imprisonment. So it is really critical. This transition is really critical. Another critical juncture is leaving residential care, which in our study often was an abrupt move into independent living, usually around about age 16, and it was rather than going back to the family, it was a move into independent living. And the experience of such transition was really, really challenging for some young people. And it's encapsulated, I've got a quotation from one of our cohort members who reflected back on this at age 35. And they said, "Nobody tells you how you're meant to live, how you're meant to pay your bills, and all of a sudden you're meant to know how to do all this on your own. And the only people you're surrounded by is people who have either been in the same situation as you and are already on drugs, or have already had experiences in prison and just kind of continue down that route. And then there's you at 16, just dumped into the middle of it." Importantly, our findings show that the care leavers who were the most vulnerable and traumatised, those who actually had the highest numbers of adverse childhood experiences, they were the ones who are most likely to transition from the youth to the adult criminal justice system. So the second lesson from research is to recognise potential mental health issues amongst young people and adults who come into conflict with the law. And I know you'll all be very familiar with this, but our findings really, really reinforce the need to recognise potential mental health issues. There's very strong evidence from the Edinburgh study that violence towards others, and also self-harming behaviours are associated with heightened anxiety and also moderate to severe levels of depression. Mental health problems in the teenage years are a predictor of continued involvement in violence in adulthood. Now, this is a really critical issue just now because research has shown that pandemic lockdowns have exacerbated mental health problems, both in children and also in adults. Our Scottish study on adolescent mental health showed a rise of 86% in clinical levels of moderate to severe anxiety among school pupils, and that was in comparison with pre-pandemic rates, national rates, and a massive 550% rise in clinical levels of depression, with around 1 in 3 of our responders reaching the clinical threshold for avoidance and intrusive thoughts. That is a screening measure, as you probably know, for use for post-traumatic stress disorder. And rates of mental health problems were particularly high amongst those who were already vulnerable pre-pandemic in terms of both their mental health, but also their family context, troubled families. Now, in sort of mentioning these findings, the aim isn't really to create a moral panic about likely elevated rates of violence because of the recent intensification of mental health problems, although there is a potential time bomb here. But it's rather to highlight the importance of screening for depression, anxiety and post-traumatic stress disorder as a preventative tool. I think it's really critical in terms of violence, potential violence reduction. And I think it's also important that it behoves all of us to be lobbying for greater investment in adolescent mental health services. So the third and final lesson is to think about the role and impact of fathers. When members of the cohort that we interviewed at age 35, we asked them to reflect on early family life. It was fathers more than any other family member that featured most in their narratives. And this would be featured mostly through either absence, not being there at all, or abandonment, through early death sometimes, or mostly through violence within the family. We found a very strong association between feelings of never being loved by a father and propensity to be involved in violence, continue to be involved in violence and have a history of violence. Moreover, those who were most likely to report involvement in serious forms of offending were at one and the same time the least monitored by their families. So their parents or caregivers didn't really know what they were getting up to, where they were going, who they were with, but they were the most harshly disciplined. And so according to our findings, fathers and relationships and family disciplining really, really matter. I want to end with some votes of thanks. Firstly to Robin Moore for inviting me to give this podcast. Secondly, to all the many researchers and administrators that have worked on the Edinburgh study over the past 3 decades, and also to my fellow researchers on the study of adolescent mental health. And finally, I really want to offer a very warm vote of thanks to the Edinburgh study cohort and the Scottish school pupils who took part in the mental health study. None of this research would have been possible without their willingness to share their stories, and I'm extremely grateful. So thank you.